So other therapies. We have oxygen. Breathing's good. Breathe in and out. Walk through the park while humming a song. You want to saturate the tissues with oxygen, which will boost the immune system and detox. White blood cells need oxygen so they can defend against infection. You can use a hyperbaric chamber that saturates the cells with oxygen. I don't know who actually does that, but I threw that in so you'd know. One of the techniques that I've used is to breathe in. So if everybody breathes in, and then breathe in a little bit more, and then a little bit more, and that'll increase, and then slowly reduce and let it out. And you can do that a couple times. You don't want to do that while you're driving, because you really get a lot more. The thing too is, the people who've had surgeries here, a mastectomy, or even have put in, implants, you'll find that you don't expand as much as you normally would because of the surgery. So if you breathe in, do that technique, you breathe in, and it'll get you to standing straighter and opening up your lung capacity. Sunlight. We want to go out in the sunlight a little bit more. Well, I think we spend too much time indoors. You want to produce vitamin D3, and it recharges you with life force and energy. The sunlight passing through the eye helps brain develop neurochemistry of emotions, so it'll decrease depression. Vitamin D3 is good for cancer patients, best from sunshine. If you take supplements, you want to combine it with vitamin K, which is the best source is green leafy vegetables, vitamin K. Too high of a dose, it can cause arterial sclerosis. What you want to do is ask your doctor to check your vitamin D levels. Most of the time, it is involved in a lot of different diseases, especially cancer. So just request a level, and then you could just go from there. You don't want to just take supplements without knowing. Hyperthermia. I just wanted to throw this one in too. Whole body hypothermia, great for advanced cancer. And basically, it's heating up the body. This is one of the therapies that some people use to treat cancer. Sleep. Get a good night's rest. So sleep problems alter the balance of two hormones that influence cancer cells. One of them is cortisol, and it regulates immune system activity, or natural killer cells. It peaks at dawn and declines throughout the day. When it peaks during the day, it is associated with increased breast cancer risk. The other one is melatonin, which is produced by the brain during sleep, and that regulates the sleep-wake cycle. And it may have antioxidant properties and lowers estrogen production from the ovaries, decreasing the risk of breast cancer. So get a good night's sleep. And these I kind of threw in as well. Complementary alternative medicine, or CAM as it's known. Ayurveda is from India. And Chinese medicine, Gerson therapy. And of course, you've come to this support group. So the difference between these methods and Western medicine is these methods look at a whole body approach. They look at your lifestyle, they look at what's going on in your life and make adjustments to that. Find your support team. Cancer is not a disease of the body part. Find someone who looks at you as a whole person. So your wellness team, this is just not even a complete list. This is just to give you an idea of the people that you want to have on your team. And I had to add social worker on there. It's like, oopsie, can't forget Juanita. So in summary, learn how to avoid toxins, detoxify your body, replenish deficiencies, live a healthy, happy lifestyle, remove stressors, power boost your immune system, support self-healing mechanisms to heal cancer. So your journey towards health. You are responsible for your own health. We're basically programmed since childhood to own that we are a victim. And of course, this group is not a victim, right? We have learned that we are passive recipients of our health and our lives. So we must change our belief system, change the programming that genes control our lives, or that forces outside of us control our lives. Must make changes in our lifestyle. So continue your journey. Ta-da!